Welcome to the second of Watson's new webinar series exclusively for alumni, where leading experts explore some of today's most pressing policy issues. I'm Wendy Schiller. I am the Allison S. Ressler Professor of Political Science and the Interim Director of the Watson Institute for International and Public Affairs. As many of you might have heard, we are launching the Watson School of International and Public Affairs as of July 1st, 2025. Today, we have the great pleasure of discussing public policy, particularly healthcare policy, with Brown University scholar Eric Patashnik. Professor Patashnik is the Julis-Rabinowitz Professor of Public Policy and Professor of Political Science at Brown University, the former director of the MPA program, and a non-resident senior fellow at the Brookings Institution. Professor Patashnik will also be taking the helm of the Taubman Center for American Politics and Policy as of July 1st, 2025. Eric Patashnik is a leading scholar on policy reform and governance. He's authored several influential books, including his newest book, Countermobilization, Policy, Feedback and Backlash in a Polarized Age, published by the University of Chicago Press. So we're very happy to have Professor Patashnik with us today. So let's get right into it. Your recent book, Countermobilization, examines the role of backlash in policymaking. Can you give us an example of a major policy change that experienced significant backlash and opposition, and how that backlash affected the implementation of that policy?
Sure. So thank you so much, Wendy, for having me. It's a real pleasure to talk to you today. So backlash politics has really been an endemic feature of American democracy in recent decades. We've had cases where a policy move has generated a strong adverse reaction among organized groups or the mass public. And at the extreme, sometimes it's led to the reversal of the policy altogether. So, for example, we had a policy called the Medicare Catastrophic Coverage Act that was supposed to extend healthcare benefits. And politicians thought that this was going to be well received. They worked very hard to build the coalition. And in some ways, to their shock, it led to a massive backlash among senior citizens. Famously, there were senior citizens who went after then House Ways and Means Committee Chair Dan Rostenkowski, chasing him down, a bunch of angry grandmas who were unhappy about the bill. And in that case, that actually led to less than 2 years after the passage of that law to the law being repealed. That was an extreme case. Sometimes we've seen backlashes prevent the enactment of a bill. So famously, during the Obama administration, there was an effort to address climate change through the cap and trade bill. That led to a lot of protest among the Tea Party and ordinary Americans who were concerned that the bill was going to raise energy prices, that it was just too much government, too much regulation. And as a result of that, the bill never passed. And it was a major factor why the federal government made very little progress in a major way of addressing climate change until we got to the Inflation Reduction Act under the Biden administration. So it really changed the whole trajectory of public policy because of that reaction. And then another example would be during the first Trump administration, migrant family separations was an extreme policy as part of the Trump administration's effort to control immigration. It was extremely controversial, led to massive protests around the country. Not only domestic actors, but international actors, including the Pope and others, argued that this policy was inhumane. And eventually, the Trump administration pulled back from that policy. So there have been many, many examples where public reactions to policies have been so negative, they've either blocked the sustainability of the policy or prevented the passage of the policies in the first place.
In your assessment, do you see a different strategy across conservatives ideologically, self-identified conservatives versus self-identified liberals, and how they engage in backlash politics?
Yeah, so in my recent book, Countermobilization, one of the things I did was draw on a database of New York Times articles about backlash episodes in the United States since the 1960s. And I coded these episodes in many different ways, but one of them was their ideological direction. And one of the findings in the book was that most backlash has come from the right historically. And that's probably not so surprising because generally when the policy status quo has been moving, usually it's been in the direction of, to the extent it has an ideological valence, in a liberal direction. Either we're expanding a program, creating a new benefit. It's been rare that conservatives have been able to eliminate programs or agencies altogether. So most backlash has really been, ideological backlash has been from the right. The current Trump administration is presenting an interesting case because here we really have massive disruption to the policy status quo, really big changes, and it's coming clearly from the right. And a key question will be, how strong will this backlash be? Where has it been strong? Why has it in some ways been relatively muted given the stakes that are involved?
So quick follow-up here. Do you see a particular type of person who either in the Congress or outside the sphere of Congress that is likely to lead a backlash? I think back to the catastrophic healthcare repeal, and John McCain had gone from being a House member from Arizona and won the Senate race in 1986 to fill the seat of retiring Paul Laxalt's seat. And so, I'm sorry, he was from Nevada. So Barry Goldwater's seat in 1986. So he was sort of the heir to Barry Goldwater, who was an iconoclastic senator as well. And then, of course, he gets there. He's a freshman senator. And then he leads the charge just a couple of years later to repeal a major program. Is that very uncommon, or do you see some connections between sort of maverick people and leading backlash movements?
Well, what I really think has been the main core pattern that I see across many cases is that the strongest backlash moments and movements really involve a combination of top-down and bottom-up forces. That's when they really become effective. There needs to be some organic reaction among the public. I'm skeptical of arguments that argue that a lot of backlashes are just astroturf movements that, are elites that are sort of pretending that the public is with them. The ones that really come together, like the Tea Party and others, do have an organic grassroots element to it, but they also receive direction, support from leaders, whether the leaders are in government, and some are. In fact, we see quite a lot of that, or they may be civil society leaders. And that's really, in the American system, that tends to be the ingredients that make these moments particularly potent, is when there really are ordinary people in communities who feel strongly that a policy change is not in their interest, and they actually do see a threat to some existing program or an institution on which they're strongly relied. And then it also attracts leadership attention, leaders that can get media attention, that can frame arguments in ways that will bring people together. And those are really the two key elements that make backlashes particularly strong.
And when you think about the rollout of a policy, how was the Obama administration just sort of caught flat-footed? Did they not really anticipate this backlash? The most powerful backlashes, are they anticipated, or are they directly related to sort of the messenger? So I think of today, Elon Musk, trimming the federal government in a rather abrupt way and sort of starting to see the bubbles or simmering of some backlash, maybe not against actually reducing the size of the government employees workforce, but the way that it's done. So can you distinguish for us, where those things kind of trigger a backlash and how they trigger the backlash?
Yeah. So what I found is that backlashes are to some degree predictable ex ante. I wouldn't call them as sort of random events that we cannot predict at all. There are certain elements of policy change that are much more likely to trigger backlashes than others. And I looked at ways in which policies impose direct, visible losses, the way in which they threaten existing institutions to which people are strongly attached, when policies are perceived as giving benefits to groups that are socially constructed as undeserving, when they significantly overreach public opinion. And some of those elements in policies can be identified ahead of time. And we do see that a lot of times backlashes are anticipated, and then policymakers sometimes are recognizing they know that a particular move might generate an adverse reaction, but they might still continue and move forward with it because they ideologically strongly believe in the change. They think it's worth the risk. Or they simply believe that there will be a cost, but it's a manageable one. But that isn't always the case. Sometimes reactions among the public are missed. And so there is some element, for example, in Obamacare, the Affordable Care Act, that the Democrats did not fully anticipate the strength and durability of the countermobilization against it. There's a political scientist, Eileen Bergen, who I think she's at the University of Vermont, if I remember correctly, did really good interviews with congressional staffers at the time that the Affordable Care Act was being developed. And she was struck by the degree to which they really were sort of overconfident about the law's reactions that it would generate. They thought that it was going to be very hard to enact the law, but as soon as the law was enacted, the public would appreciate the benefits and that the opposition would really die down. And so they didn't fully anticipate how long this post-enactment battle over Obamacare would be. They didn't see that they would be fighting over and over again to protect the bill from repeal. And in fact, the law came quite close to being repealed during the Trump administration. Had John McCain not saved it, we might not have the law. And so there are moments in time when actors can be, perhaps because they have ideological blinders on, or they didn't fully appreciate how polarized our current environment is, they don't always foresee the negative reactions that a policy might generate.
And you point out that, there can be sort of mass backlash, but it also sometimes takes somebody in a position of power to sort of really, foment that backlash, but then either prevent it or make it go forward. So it's sort of an interaction in this system. You are a leading expert on healthcare policy in the United States and also in comparative context as well. There's going to be a lot thrown at the American people about programs called Medicare and Medicaid, and in particular, Obamacare or the Affordable Care Act. Is there any way for our audience you could just unpack a little bit what we might be seeing from the Trump administration and then what you see as seeds of potential backlash in these programs?
Yes. So I think healthcare is very much on the agenda. The new Republican majority has a couple of goals. One of them is to extend the Trump tax cuts. And that's going to be very expensive. And they're looking for ways to help offset the costs. They also have ideological goals of trying to shrink government and particularly reduce redistribution. And that's important to this majority. And so because of those goals, both Medicaid and the Affordable Care Act will come very much in play. I haven't seen any signs that the Medicare program for senior citizens is likely to be directly attacked by this Congress. But Medicaid, I think, will. Medicaid is the program for low-income Americans. It now it's expanded dramatically. So now about 70 million Americans are on Medicaid. And it is not simply a program for the very, very poor. It's also a program for a lot of working class Americans, as well as for older Americans that have spent down their assets and depend on long-term care. And so it is really deeply woven into the social fabric. 40 states have expanded Medicaid to a wider population under the Affordable Care Act. That program, though, is very expensive for the federal government. And so this is the area where I see both the greatest risk to the safety net and also the greatest potential backlash risk for the Republican majority. If they directly attack Medicaid, and they've sent very conflicting signals. President Trump on one day says Medicaid is not on the table. The next day he says it is. It's very unclear how to read those tea leaves. But there's lots of ways to attack Medicaid without eliminating the program altogether. One could impose work requirements that many Americans would agree with in principle, but in practice, we know from past attempts, often don't really increase work effort among recipients because a lot of those who aren't working are disabled or are caregivers or are not unable to work, and might create a lot of administrative hurdles that would prevent people from getting benefits to which they're eligible. And so if we see Medicaid directly attacked, that could cause backlash among multiple populations. One is the groups that are getting the benefits themselves. Obviously, they're a group. And I think we will see a reaction there, particularly if it affects the most sympathetic and vulnerable constituencies, the disabled and senior citizens that are receiving both Medicare and Medicaid. There's some dual eligible populations, but it's not only them. The other powerful stakeholders that could be major backlashing actors and really counter-mobilize against this would be state governments that depend tremendously on federal funding to pay for this program. If they lost that federal funding, they would either have to cut Medicaid, which would be very devastating, or they would face massive deficits at the state level, and they're not prepared for that. And then also key institutions like rural hospitals. Rural hospitals depend tremendously on this funding. And so this is not simply a matter of blue states. This is across the country, but including in a lot of Republican states. As Medicaid has expanded, we now have a lot of constituents that are Trump voters that are on Medicaid. In fact, we've seen actors like Steve Bannon, for example, not the person you would expect to be defending welfare state expansions or the Obamacare, but he has been sending cautionary notes to Republicans that the Republicans need to be very careful because there are a lot of Trump voters who are depending on Medicaid.
So this is, just to interrupt you for a second, just tying this back to electoral politics and moments in time, the actual switch of the Democrats now that, 60% of people with a college education are Democrats, and having people who have less than a college education or high school education, the vast majority now are Republican in some parts of the country. And the fact that very poor states like Louisiana, Mississippi, they receive a very large subsidy from Medicaid to actually pay their bills. So other states split the cost, but they get even 60, 70% of those costs covered by the federal government. So I'll ask you a specific question about this, which is, if it were to be block granted. So Ronald Reagan really transformed social welfare policy in so many ways by block granting a whole, temporary aid to needy families, something we used to know as AFDC, aid to women with children. That is block granted. So if you block granted Medicaid, how do you think that would play out in particularly deeply Republican territories?
Yeah, so over time, I think that would lead to significant reduction in Medicaid services, because as the cost of healthcare is likely to go up faster than the block grant would increase, it would be one way for Republicans that want to cut Medicaid to try to break the traceability train, because maybe in the first couple of years, there wouldn't be massive impact on beneficiaries, but over time, it could lead to a significant reduction in funds available to cover the rising cost of healthcare. So that is a big concern. And this is really, I think, one of the key issues to look at. The other one you mentioned was the Affordable Care Act itself, and that is during the Biden administration, the subsidies to provide people who get their healthcare through the marketplaces on the Obamacare exchanges, they became more generous. They made healthcare more affordable. Well, if you reduce the generosity of those subsidies, that would lead to some people being no longer able to afford that coverage, and we might see a tick up in the uninsurance rate. Now, regarding backlash politics, so this is where it becomes super interesting, because we have seen repeatedly healthcare has been a cause of backlash at the electoral level, and it's moved in both directions. So in 2010, the Democrats had a terrible midterm, and they lost, I think, 63 seats. We know empirically that Obamacare was a big reason. Members of Congress from marginal Democratic districts that voted for the ACA as well as cap and trade were more likely to lose their seats than other members. At that time, Obamacare was a new law, wasn't yet entrenched, hadn't yet built a positive constituency. Some of the positive feedback that we see now hadn't yet been consolidated. So it was a very vulnerable program. And we know also empirically that programs tend to be most vulnerable to repeal in their first decade of operation before they really put down those roots. And so that was a blowout. But then it went the other way. Ironically, Obamacare's popularity had been underwater for most of its first decade of existence. And ironically, it only gained popularity when during the Trump administration, the first Trump administration, when there was finally a credible effort to repeal it. The Republicans had voted over and over and over again to repeal the ACA. But of course, they weren't in a position to do anything during the Obama administration. But when finally they had unified Republican government and President Trump, now it was a real threat. It really could be repealed. And that focused the minds of many Americans, in fact, Republicans as well as Democrats, who realized what they could lose. And as a result of that, the popularity of Obamacare ironically went up during the Trump administration. And there's evidence that that threat to repeal contributed to the Democrats very good midterm in 2018. It was a bad midterm in that blue wave midterm in that year. So we've seen on both sides that when it comes to healthcare, Americans are very skittish and they don't like change, even though they think the system is expensive, it doesn't work well, they have a lot of complaints about it. They're very nervous that any change could make things worse for their situation. And we saw that with Obamacare. A lot of people were very worried who had private health insurance that the ACA was going to make, they were going to lose something. And so that's part of the reason why it was so unpopular in the beginning. And then finally, it took a while, but for the ACA to begin to be accepted and ingrained and grow a constituency, then when people got used to that, then the Trump administration came along and said, no, we're going to take that away. Suddenly people said, wait a minute, I don't want that change. So any kind of wrenching change can lead to a great deal of uncertainty and risk aversion among voters. And that is a recipe for backlash politics.
So do you see this as a potential moment when we're thinking about cuts? Obviously, we're academics, we work at a university. Cuts to higher education, particularly the sciences and the healthcare enterprise, the National Institutes of Health, among others, and funding for all sorts of medical research, and sort of the availability of care through Medicaid, Medicare, which pays subsidies really to a lot of the universities and the university hospitals, particularly in urban and rural areas. Do you see sort of an opportunity for an entrepreneur to say backlash against both? That if you're cutting all this research money and university assistance, you're actually going to hurt the healthcare system, or do you think it's too complicated?
Yeah, so you're putting your finger on the key issue of why right now we are seeing some bubbling up of backlash with the Trump moves, but it's been relatively muted so far. And why is that? Well, I think there are a couple of reasons. One is some of the targets that DOJ has been going after are frankly targets that are very hard to defend. Foreign assistance, for example, that's just never been very popular among the public. Waste, fraud, and abuse. Americans believe there is waste, fraud, and abuse in government, and so it's really hard to mobilize against that. In a lot of those areas, these are sort of weak targets that they're going after. And then the other reason is, as you suggested, some of the areas that Americans might be concerned about and might countermobilize, the connection is hard for them to see between these particular moves and NIH funding cuts. Is that really going to affect the quality of my healthcare tomorrow? What's how do I get from that move to this other thing about my cancer treatment in 5 years if I were to get cancer? And it's mediated by the fact that a lot of this money is these studies are carried out by universities, and universities have lost a lot of trust among the public. It's really been devastating. And it's one that I think we in the university have not fully recognized how consequential this is, how much in the United States we depend on the public for our legitimacy, for our support, for our finances. There has been a dramatic decline in confidence in universities, particularly among Republicans, but not only so. And so a lot of these cuts are being focused on medical schools, public health schools. There's been a tremendous erosion in confidence among them, especially among Republicans, especially since the pandemic. And that does make it harder, I think, for these institutions to say, we are the institutions that are serving the public good. We are curing disease. We are providing the biomedical innovation. Those arguments are there to be made, but it's more challenging because of this erosion of trust.
So I have just two more questions. One is, when you think about associations and you think about, well, how will I be affected by these cuts? If you're in a clinical trial or you've got a relative in a clinical trial and that clinical trial gets stopped, these, for a lot of people, these are months and certainly, the last chance at survival. When that happens over the next couple of months, if it does, there could be a contribution to grassroots sort of mobilization to see that connection. Mm-hmm. But if you are opposing the Trump cuts, that's a pretty grim and morbid way of spurring a backlash. Is there a more positive way, theoretically, of making these connections if you oppose them, and sort of how to be active in doing that and getting that messaging across?
Yeah, I mean, I think that the best near-term opportunity for those that want to defend, for Democrats, progressives, and others, is going to be on Medicaid. Medicaid really was the key to the backlash against ACA repeal. It wasn't only about the ACA. It was a fact that the first Trump administration was proposing massive cuts in Medicaid, and it was hitting extremely sympathetic constituencies, the disabled, seniors, rural hospitals. And so that may be coming. And I think that is the most likely vehicle. And so, it's going to be difficult, I think, in some of these other areas. There's some areas where, Democrats are out of step with public opinion, and Trump is closer to the median voter in some areas. When Trump clearly overreaches, and Medicaid cuts would be one, that's where there's the greatest opportunity to say, this is not what Americans voted for. They were voting for Trump to bring down the cost of living. They were, voting to control immigration. They were not voting to decimate the safety net for vulnerable people. And that's really the greatest area. On some of the other areas, I think that it's going to be difficult. The universities, they are in a difficult position to try to mobilize a grassroots support to defend their research enterprise. They may be in a position now where they're going to have to make some changes, to bring public policy in line with where public sentiment is. And, I think you could argue that some of what's being proposed, and the 15% is, the NIH indirects might be too extreme, that maybe you can make an argument that would appeal to some moderate Republicans in the Senate, particularly, that's really will have some effect. We've seen that with Susan Collins and Murkowski and others, that if you go that far, that will really harm medical institutions, not only in coastal blue cities, but in throughout the country. I think that argument could be there, but it's going to be hard to argue that the universities can't manage some reduction and that there's no inefficiencies there. So I think they're going to have to, be strategic and try to defend the core area of these programs, but also recognize that this might be a moment where some change will happen.
So I'm going to close with a really broad question, which may not be fair, but I want to ask you, with your extraordinary knowledge of not only modern public policy, but the history of public policy, when we think about the role of the president, and we think about key presidencies and policymaking, we associate Franklin Delano Roosevelt, FDR, the New Deal, the Great Society with Johnson, for example. We associate foreign policy and even domestic policy, expansion of Medicare, for example, under George W. Bush, and Obamacare is labeled Obamacare. So two things. What do you think about that sort of power of an individual president to reshape the way policy is delivered, create new policy? It's hard to think of unraveling policy. We haven't really had that. That hasn't happened yet. Do you see Trump as being able to do that? Or do you think Trump emerges as creating a different kind of policy infrastructure using the power of the presidency?
Yeah, I mean, of course, the cop-out answer is it's too soon to know. But I do think we're in a moment of tremendous potential reconstruction of some core operating assumptions of how American politics and policy has worked over the last half century. We certainly see it in foreign policy. It's quite likely, I think, that the second Trump administration's most important legacy 50 years from now will be a tremendous change in America's place in the world, its relationship to its allies, our foreign policy. I think he seems to be making a very, very big pivot, a pulling back of the historic U.S.-European alliance, in some ways a neo-isolationism, but certainly not a Wilsonian kind of American role in the world. And to the extent that he is able to bring that about, that would be a massive change and potentially one that really creates a durable legacy. In domestic policy, we're at a key moment. Will there actually be a fundamental change in the federal role in ordinary Americans' daily lives? I don't know. There's the attempt to do it. I'm somewhat skeptical that it will be successful. Will we really see a dramatic decline as a share of GDP, federal spending? Will we really see a return to, millions and millions of Americans without health insurance? There I'm skeptical. The part that I think does seem to be happening and is also one to watch, besides the foreign policy, is really this growing strength of executive power vis-a-vis Congress. This unitary executive idea that the president really holds not some, but all the executive power. We're seeing, I think, a significant erosion of the independent agencies. We're seeing a politicization and a personal control over agencies like the FBI, the Justice Department. Some of these things may go too far, but the Supreme Court, which is a conservative supermajority, I think is part of this project of believing that the federal, that the power of the executive needs to be much stronger. And I think is going to be willing to bless a lot of those changes. So if that happens, that could be a massive change in the separation of power system. And we could be entering a period of significant decline in Congress's role in federal policymaking. I've always thought, and the Constitution says, the Congress is the first branch, Article 1. We're a diverse society. Congress is the lawmaker, but Congress, members of Congress of both parties, for different reasons, have delegated tremendous power to the president in trade. We saw Biden unilaterally make decisions about student loans, whether you agreed with them or didn't. Those were presidential decisions that involved massive amount of money that Congress wasn't directly involved with. And so this is a continuation of some of those long-running trends and really coming perhaps to a zenith and maybe something that will be blessed by the Supreme Court. And if that happens, the American Republic will look really different in how it operates than it did when you and I were growing up.
Yeah, that's a great summary. Article 1 is much longer than Article 2, which is the expression of powers of the presidency. So we could continue this all day, but we don't have the time. Thank you so much, Eric Patashnik. And your new book is entitled Countermobilization, Policy, Feedback, and Backlash in a Polarized Age, University of Chicago Press. And we really look forward to everything you're going to do at the Taubman Center in the new Watson School of International and Public Affairs. So thank you so much for joining us today.
Thank you. It was a pleasure to be here.